any member of council?
No.
Hearing none, we'll record that. There's no minutes to be adopted, no deputations or presentations. Moving into committee of the whole. We don't really need to do briefings, no unfinished business, and we are at the administrative report. So I will turn it over to Kelly.
Thank you, Madam Warden. Sorry, a little slow on the unmute there. So the report is in front of you. We've had several discussions with the City of Kingston, Dr. Moore, and Warden Isbester from Ludington Addington. I would note that Ludington Addington had the same report yesterday at their county council meeting at 2:30 and passed the motion. And I'd turn it back to the warden if there are any questions.
Okay, who wants to start?
I have a question, Madam Warden. If in actual fact we did reopen on some kind of regional basis, what kind of position we would be in with our personnel in regard to being able to continue to provide protection in regard, are people getting tired? Are long-term care workers wearing down a little bit? I just wondered if Kelly could give me a little bit of a view into that as to what position would we be in?
Kelly?
There we go. Certainly from a staffing standpoint, our call volume for paramedics is down during this. Nobody wants to go to the hospital needlessly, obviously. Having said that, their time on task is increasing because they're putting their PPE on, and the stress levels with staff is pretty high. We aren't granting large blocks of vacation at this point either. So I suspect that when this ends, that there's going to be pent up vacation demand. In long-term care, similar kind of thing, but I think the stress level in long-term care is even higher, obviously, because of the situation. We began on, I'm losing track of time, Wednesday and Thursday, testing all staff in long-term care, plus all of our residents. Some of our staff received their results this morning. So far, all negative, but I don't want to go too far out on a limb and say that that'll be the case with all of the tests. There's about 175 staff and 120 some residents that are being tested. So approximately 300 tests are being conducted by our paramedics. So in particular, I would suggest that long-term care and paramedics are stressed, but likely for different reasons. And that when this does end, there's going to be some pressures for vacation time and just some downtime. So.
Okay.
It's Dennis. Madam
ahead,
Warden,
Dennis.
may I speak?
Yes.
Yes, as you can imagine, there's been a lot of work going on behind the scenes at Public Health. And we were lobbying going over the last few weeks for opening up the community gardens. And thanks to Alan opening the cat trails back up, because there's a general feeling that we're a whole lot better off outside than cooped up inside, and very low risk to spread this virus when you're outside, as long as you keep social distancing and wash your hands if you've been touching things outside. We're very supportive of this resolution, because we do want to safely open up the economy, and we're in a perfect region, I should say a perfect position in our region, because we've got a low number of cases and no deaths, and an excellent system in place to monitor things. Thanks to all the long-term care homes, we've been working closely with 7 of our staff that used to do inspection work at restaurants and so on. They've been reassigned to visit all the long-term care homes every week or more often. And just last week, we started bringing nurses in with the inspector, so that we give any remedial training that may be necessary. So we've been so far quite fortunate to not get the big spreads that other regions have. So I'd like to move the resolution that we endorse approve Fran signing the letter that both Marg and Ryan, I think, have already approved at their councils. Thank you.
Okay, do we have a seconder for the motion?
I'll be willing to second it, Fran.
Okay, Alan? Let me read the motion at this point and we can discuss it further. Be it resolved that the Office of the Chief Administrative Officer advocacy for regionalized lifting of restrictions be received. And further, that County Council authorize the warden to co-sign a letter to the province advocating for a regionalized approach to the lifting of restrictions related to COVID-19. Are there further discussions? I think the big thing is we want to have something that will work for our areas and not just the big cities. Okay, if there are no other discussions.
Councillor Higgins,
Oh, sorry, Fran.
Okay,
Sorry,
go ahead.
wait, you didn't see my hand up.
No, I didn't see you.
So what are we actually approving here? Are we approving the report that's going along with this agenda today?
You're approving the letter and the recommendations. Now, those recommendations may be tweaked a little based on today's numbers and what's actually happening on the ground today.
Yeah, I have a couple of comments, and what I didn't see in any of this report is the opening up of lodges, trailer parks, or campgrounds, or golf courses. And in phase one, they're not recommending to open marinas, which I disagree with. How do we address that in this? Do we add things into this?
Well, basically Dr. Moore is taking the lead on this. And if he feels those things can be done safely in phase one or phase two, then if the province approves us, then we'll need to get down and have more of those negotiations about what could open and how it could open is the way I see it happening. Kelly, do you want to speak to that as well?
Yeah, I agree, Warden. All this is doing is asking for permission to work with the province to have a regional, rather than having to follow rules from the city of Toronto. So as things change, and I think Dr. Moore has been very clear in his discussions with the two wardens and with the mayor, that he's not looking at this point to make specific statements about specific services, that we're looking for permission to be able to make those decisions. So the end result would be that if the province agrees, that together we would be making decisions that make sense locally based upon local conditions rather than conditions in the city of Toronto or the city of Ottawa. So I think to Councillor Higgins' point, if those are things that are important, those discussions will come, and in conjunction with the medical officer of health, those decisions could be made locally. Otherwise, they're just going to be made at the province and we'll have no input.
That's the way I see it as
so
well.
This report isn't all inclusive. We can add things in, as the way I understand Kelly just described it. We can add things when we get to phase 1, 2, and 3.
It's a starting point, I think, for discussions.
Yeah, so it authorizes the warden to sign the letter to begin the discussions with the province of Ontario.
That's right.
Okay, thanks for the clarification.
Okay. Any other questions or comments?
Yeah, I have just one question. I know that the CAO, for Vanderwall, I know that the CAOs have been talking and they've had some meetings. When do we talk about lifting the emergency order if nothing has changed worse than what it is now?
Well, my estimation is I believe the province is up until the 12th of May, and they're going to look at whether or not to lift the emergency designation at that point. And I think Dr. Moore, in our next meeting on Monday, we can ask him that question, because I think he was very helpful in us deciding to call the state of emergency in the first place. I think that would be a good discussion for us to have with him.
Okay, thank you.
Any other questions or comments?
Madam Mayor, Bill here.
Yes.
Yesterday, I overheard the Premier's interview in regard to what would happen in phase 1 and 2, and he had the Minister of Labor on, who basically laid out that when and ever it starts to open up, that every workplace will have a whole set of rules around how they can continue operations with those rules, and that they're hiring something like 60 or 70 extra inspectors to actually go around and ensure that the rules under the reopening are being adhered to. So I think that they're working on getting the province opened up because they realize it's necessary. Spring of the year, especially in the construction industry. So I think what we're doing today is just indicating to the minister, to the province, that we're ready to open up. But I don't think that by passing this, that's all we are doing, is indicating that we're prepared to move forward with an opening up. At least that's what I'm concluding. Thank you.
Well, we're asking the province to give us the go-ahead to work on a local solution. He did say yesterday that he was concerned if we did something that excluded Toronto, that people might flock to the one area that's opened up. So he may not approve us doing this, but he may. If he does, then I think we need to then get to work as to how we do this very cautiously.
Right. I agree.
And just one last comment, Councillor Vanderwall, they do recognize, they said that every area is different.
That's very true, yes.
Yeah.
Yes. Okay, any further comments? I'm going to ask again, the way we did it before, are there any no's? Hearing no no's, the motion is carried.
That's like a double negative, no no's.
No no's, okay. There's no reports from anywhere. Any public question period? I guess not, no other business. So we have a bylaw to confirm the proceedings, moved by Bill and seconded by Ron H. Be it resolved that leave be given to the mover to introduce a bylaw that's been circulated to all members of County Council, and the bylaw be read a first and second time. And a third reading, moved by Jerry and seconded by Alan. Be it resolved that bylaw A be read a third time, signed and sealed and finally passed. So to confirm all actions and proceedings of County Council May 1st. Any other questions or comments?
Madam Warden, we need
Let
to
me
call
make a
the
comment.
question.
Say that again, Alan?
Need to call the questions.
Yes. Oh,
Please.
sorry. Very good point. Is there anyone saying no? Hearing none, motion's approved. All right. Motion to adjourn.
Fran, just before
May I
that,
make a comment?
Sure. Dennis and then Jerry.
yes, I just want to thank everybody for the support for public health. It's a real team effort, and let's just keep working on it, and we'll get things opened up, I think, quicker than any other region in Ontario. Thank you.
Okay, Jerry?
As a comment, when we look forward to our own township offices, each one of us, the personal protective screens are going into a backorder situation in Ontario. And I think we should be proactive and look about acquiring or purchasing screens for each one of our offices before we, because sooner or later, we're going to reopen to the public and it will be a requirement. And I think we should be proactive and look now and have our offices or our CAOs try to procure these items. Thank you.
Okay. Kelly, is that something that's been spoken about with the CAOs?
It didn't come up at our CAO meeting on whatever day that was this week, Tuesday or Wednesday. But I will speak to Tom Mercer, and I know he had looked at it for a couple of situations at Fairmount. And the difficulty was that all of the grocery stores and there's a pent up demand for them, as Councillor Martin was saying. So we've got a couple of situations here at the front desk and at Fairmount that are going to require them probably when we do open up. So I'll talk to Tom again today.
Okay. Okay, is there anything else? Seeing none, thank you all for joining today, and the meeting is adjourned until May the 20th, unless we need to have a special meeting in the interim.
Stay safe, everybody.
Yes,
Bye.
bye-bye.
Bye for now.
Bye.
Thank you.
Have a good day.